What is panic disorder? Panic disorder is an anxiety disorder that includes the occurrence of panic attacks. Often, there is little to no warning that a panic attack is about to occur, which only adds to the heightened anxiety already experienced by the individual. If left untreated, panic disorder can lead to the development of other emotional problems, including a wide range of phobias. While the degree of severity will range from one individual to another, a person who suffers from panic disorder will often exhibit at least a core group of symptoms. Common panic disorder symptoms include sensitivity to light and sound, ringing in the ears, extreme mental and physical fatigue, insomnia, and a feeling of being mentally and emotionally frail. Part of the reason for these symptoms is that the nervous system is oversensitized. In this state, sounds and movements that normally would trigger little to no conscious response become almost impossible to process. Along with the constant sense of being overstimulated, a person living with panic disorder frequently experiences episodes known as panic attacks. During a panic attack, the individual may feel as if he or she is about to lose consciousness, become insane, or even die. Some people also experience an overwhelming urge to flee or to remove themselves from other people, especially if the attack occurs in a public setting. While a typical panic attack only lasts for a moment or so, most people with this type of disorder experience a series of attacks that follow in close succession. As one attack begins to subside, another attack begins to build up as the subconscious anticipates the recurrence. To the individual with panic disorder, this makes it seem as if a panic attack lasts for anywhere from 10 minutes to an hour or longer. Because of the negative impact a panic disorder has on the ability of the individual to function, it is not unusual for agoraphobia to develop. Essentially, agoraphobia is a fear of being in a public setting. This fear often comes about because the individual is afraid of experiencing a panic attack while around other people. Coupled with the onslaught of visual and audio stimuli that is often present in public places, the individual begins to avoid any place that holds the potential to trigger an attack. Many people assume that the best way to control a panic attack is to resist it. However, some mental health specialists recommend a process that involves embracing the attack, recognizing that the worst does not come to pass, and thus begin to rob the attacks of their power. Similar treatments, such as CBT or cognitive behavior therapy, can also help patients deal with panic disorder and any related health phobias that may have developed over time. Medication is also often helpful during recovery from panic disorder. Various types of anti-anxiety medication provide some degree or relief within minutes. If depression has developed as a result of this type of disorder, the physician may sometimes prescribe an antidepressant. In situations where the disorder is caused by poor diet and exercise habits coupled with an extended period of stress, the physician may also recommend a vitamin regimen. The vitamins help to reinvigorate the body's weakened immune system and provide the nervous system with the nutrition necessary to restore mental and emotional balance. Many people turn to herbal remedies in order to deal with panic disorder. Some of the most commonly employed herbs include lemon balm, chamomile, peppermint, skullcap, hawthorn berries, St. John's wort, and passion flower. However, it is important to never take herbs along with prescription medicines without first consulting with a physician, as many herbs can trigger an adverse reaction when coupled with medication. What are the signs of panic disorder? Panic disorders are marked by violent, incapacitating lapses in rational thought and emotion called panic attacks. One of the most recognizable signs of panic disorder is the repeated onset of a panic attack. Symptoms of a panic attack can vary in severity and duration, but frequent attacks point to signs of panic disorder that can significantly disrupt an individual's day-to-day life. Extreme, pervasive emotions characterize panic disorder. Individuals with panic disorder also experience symptoms that affect their composure and behavior. Recurring panic attacks are one of the clearest signs of panic disorder, in some cases causing a persistent change in behavior because of the fear of experiencing another panic attack. Panic attacks affect an individual's emotional and physical stability. Extreme fear and terror, often focused on the fear of dying, are the most common emotions associated with panic attacks. Panic attacks that are related to panic disorders are evidenced by prolonged periods of anxiety, The intensity of these emotional responses are accompanied by physical reactions that can be debilitating. These signs of panic disorder often occur suddenly and without explanation, further hindering an individual's ability to carry out normal, daily routines. The physical symptoms of panic disorders as indicated by panic attacks are often outwardly visible: bouts of sweating, chills, and nausea. Is it not uncommon for the sufferer to feel his heart race, have heart palpitations, and experience difficulty breathing, which can exacerbate the fear and anxiety? First-time sufferers commonly mistake the severity of the symptoms for a heart attack or some other unrelated physical illness. The combined emotional and physical toil that sufferers endure can result in a persistent cycle of fear and seclusion. The duration of a panic attack is generally short and can vary from a few minutes to a couple of hours, but even when the initial attack has mostly subsided, some symptoms may continue to persist. Signs of panic disorder are present in nearly 6 million people in the United States, with women twice as likely to be affected as men. Because panic attacks often appear without warning, people with a tendency towards repeated attacks come to fear the very idea of it happening, which then triggers episodes often referred to as anticipatory attacks. This fear can ultimately lead to a need to avoid locations that may provoke an attack. Lack of proper treatment can eventually cause complete aversion to any public setting or open space, as is the case with nearly one-third of panic disorder patients. What are the causes of panic disorder? Panic disorder, characterized by debilitating and reoccurring panic attacks, has no known single cause. Etiology of a disorder shows that genetic predisposition and socioeconomic environment are factors in determining who is susceptible. Therefore, a person who is a close family member with the disorder has a significantly higher risk of developing it. The physiologic symptoms of panic disorder are caused, in part, by low levels of serotonin in the brain and an overactive sympathetic nervous system response. The onset of panic disorder is caused by panic attacks becoming closer and closer together, with the person experiencing them beginning to show anticipatory fear of the actual panic attack and not just fear of the trigger. Repeated panic attacks lead to the body being in an almost constant state of arousal caused by the fight or flight response, a human adaptation that arose in response to physical danger in the environment. This response is triggered by an event that the brain perceives as dangerous. Nerves in the autonomic nervous system, ANS, initiate adrenal release from glands in the kidneys, and the kidneys pump adrenaline and noradrenaline throughout the body. These chemicals raise the heart rate and blood pressure in order to get more oxygen to the muscles needed to either run from or physically attack the perceived danger. In a person without panic disorder, after the danger has passed, the parasympathetic nervous system initiates a series of biochemical events to bring the body back to a state of homeostasis. When the sympathetic system is stimulated by the panic response too often, it may not be able to effectively shut down with the help of the parasympathetic nervous system, which can also develop dysfunction related to the causes of panic disorder. Decreased oxygen supply to the brain causes dizziness and feelings of unreality that are associated symptoms, as well as other symptoms of oxygen deprivation like cold and clammy extremities. The body's reaction to the trigger forces it to focus entirely on the perceived fight at hand, and the person suffering from panic disorder may have problems with memory, cognition, and attention. Genetic variations may be a factor in the serotonin aspect of the causes of panic disorder. Research shows that just as patients can be predisposed to develop major depression because of lack of the genetic code to create adequate receptors, the same holds true for individuals with panic disorders. For this reason, doctors have success treating the causes of panic disorder with selective serotonin reuptake inhibitors, SSRIs, and similar drugs. Benzodiazepines can be used to treat acute panic, and cognitive behavioral therapy, CBT, is generally recommended to effectively treat the whole spectrum of the causes of panic disorder. Visit the website, click below.
I hope you enjoyed our review. If you would like to order this product or see further details, then simply head over to the website address you see on the screen right now.
Click below.
I hope you enjoyed our review. If you would like to order this product or see further details, then simply head over to the website address you see on the screen right now.